morning everyone, and welcome to today's WorkSafe Tasmania Month webinar, Self-Myofascial Release and Stretching in the Workplace. I'm Stephanie from WorkSafe Tasmania and the coordinator of WorkSafe Tasmania Month. I'll also be your moderator for this morning's session. Before we do get started, I'd appreciate you taking a few moments to read the following slide about information delivered during WorkSafe Month sessions. I'd now like to go over a few items so that you know how to participate in this morning's webinar. So we've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your computer screen in the upper right-hand corner. You're likely listening in using your computer's default speaker system. If, however, you'd prefer to phone in, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing in your questions in the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect all questions and address them at the end of this morning's presentation. We are also recording WorkSafe Month webinars that we are running, and we'll progressively get them on the WorkSafe Tasmania website. Lastly, once you leave today's webinar, you will receive a survey at the end. We would appreciate it if you do take a few moments to complete that survey and provide us with your feedback. I would now like to introduce you to this morning's presenter, Diana McShane from HealthSeek, to present self-myofascial release and stretching in the workplace. Welcome, Di.
Hi Stephanie, thank you very much, and thank you everyone who's joining us today. Obviously the topic of today's presentation is self-myofascial release and stretching in the workplace. With the aid of tools such as spiky balls and foam rollers, followed by relevant stretches, and it's the impact and the benefit that they can have for your physical and mental well-being in the workplace for both employees and employers. So just to move on from there, the workplace can be an environment of high stress, which I'm sure you're aware of, and it can play havoc on our bodies as well as our minds. If we don't feel good in our body, we know how that can impact our thinking, our creativity, our concentration, and so on. It can also place our bodies in constrained postures, often repetitive in nature, and cause imbalances and tensions in the muscles, which over a long period of time can be debilitating, restricting mobility and range of motion. And these effects on your muscles can make it difficult to sustain concentration and/or physical effort, therefore affecting productivity. So musculoskeletal pain conditions have been found to be placing a significant burden on the workforce. Through improved management of these conditions, it may lead to improved productivity, benefiting both employers and workers alike. Through the use of ergonomics and postural awareness alongside myofascial release and stretching, studies have shown a positive effect in improvement of the range of motion and significant pain reduction. So what is self-myofascial release? Well, it's just really another word for self-massage. We use such tools as a foam roller or a spiky ball, and they aid in the breakdown of soft tissue adhesions and scar tissue in the fascia. So fascia is a three-dimensional fibrous matrix that basically interconnects through all the cells of our body. It surrounds the muscles, the bones and joints, and gives our body structural integrity and strength. Abnormal fascia can be the leading cause of chronic pain, reduced flexibility and decreased performance. SMR, self-myofascial release, is an effective, inexpensive and convenient way to both reduce adhesion and scar tissue accumulation. So I want you to think about the the scar tissue and all the abnormalities within your fascia and your muscles and so on, and think about it like a rope with a knot in it. So if we think about the knots that we have in our muscles, we tend to refer to them as knots. We all have that feeling of knowing what you've got a knot in the top of your neck, or in the top of your shoulders and through the neck, and you feel like it needs to be worked out. Well, it is. It's like having a rope with a knot in it. And if you stretch that knot, stretch that rope, that knot's going to get tighter. So it's a matter of trying to work that knot out, and then of course you've got more range. The same applies to your muscles and your fascia. So that's the basic principle of what this self-myofascial release can do, and it can therefore give you more range, more abilities to strengthen or stretch and then strengthen. So how long does it have to take? Well, it really only needs to take a few minutes depending on the level of your need, and particularly if it's broken down into body regions and performed at different times. So you might find that you've got some tightness through your upper back, so you work onto your chest and your upper back. Great opportunity to get up out of the chair or move from your position where you are. Get that blood flowing into the region, and it just makes you feel that much better. So therefore your concentration improves, your productivity improves, and it also gives you a change from your position that you're in, which is really, really important. So what difference can it make? It improves blood and lymph flow to the muscles, promoting healthy muscle tissue, which is more responsive to the demands placed upon it. It improves range of motion, making it more responsive to stretching, less pain, less inflammation. It improves nutrient flow and the removal of waste products. It also aids in the promotion of relaxation, reducing stress, anxiety and depression. The enhancement of the immune system, which also then reduces pain, stress and anxiety. So desk work, which is unfortunately comes along with a lot of our modern workplaces these days. You may have heard the latest information, which is indicating that sitting is the new smoking, and it's pretty scary. I'm sure we've all experienced the feeling of stiffness and soreness after sitting for a prolonged period or even for a short period. Our body was simply not designed to be stationary and constricted for that long. The results are short and tight hamstrings, short and tight hip flexors, long and tight gluteals, short and tight pectorals, long and tight posterior thoracic, and so on. You get the idea. And it's all around the wrong way. So it leaves us in this stooped forward position, which is really hard to stretch out. And it's also then hard to attempt to strengthen it because they're all in the wrong positions. Hello hunchback, not a nice thought, and quite debilitating on many levels. So it can even have a huge effect on our breathing. If you think about when you're sitting hunched forward, everything's crunched up into that rib area. Your lungs not get that open breath that they require. Your diaphragm's all constricted. That therefore leads on to problems with circulatory system and your digestion as well. The flow-on effects are quite scary. So to release some of those long, tight or short, tight muscles, we give your body just a chance to not only get out of that sitting position, but allow the muscles to get a chance to relax a little and get some blood flow to the region. If you then combine that with a stretch and some basic corrective strength work, you'll just be feeling a whole lot better and therefore able to think more clearly. Gives you a break from what you're doing, and you can actually use that as a bit of thinking time as well. So standing work. There is a new focus on standing desks, which is just fantastic. I really think that's a really great thing to be thinking about. However, we must also be careful that we're still maintaining good posture and positioning, as standing for prolonged periods can also cause problems. So there is also, of course, those in the workforce who have little choice but to stand and in fact do a lot of manual labour, which can be repetitive and create imbalances and unwanted body aches and pains. So again, it is vitally important that the muscles that are working to hold one position for prolonged periods or basically contracted are given the opportunity to be released and lengthened, whilst those that are extended are given the chance to release and strengthen. This is particularly so if the posture is poor to begin with, and I'm afraid to say that the percentage of poor posture in our population is very, very high. Injuries will occur at some stage if this is not addressed. It's just a matter of when. So consider the notion of optimised and varied movement being the key to maintaining a mobile person, whether you are a sitter or a stander. Prolonged stillness of any kind will cause damage. Our bodies are designed to be mobile. So what are the body regions that are affected by desk work? There's just a little table there that you can have a look on. I won't go through each and every one, but you can see, for example, your knees, tight quads, then you've got hamstrings. I'm sure if we stand up out of the chair and we feel that feeling of your hamstrings just going, oh really? Gluteals, sore bottoms, leading to sciatic pain in some people, hip flexors. Now that's a really good example. I'm sure we can all think of the time where we've been for a long car trip and you get up out of the car and you feel like a robot as you just slowly spring yourself up to that standing extended position. And it's a horrible feeling. There's also problems through the back of the neck and the shoulders, the chest muscles, which get really, really tight and drag those shoulders forward. So it's about opening that. You'll see the couple of little pictures in the bottom of the screen there, particularly that one of the sitting at the desk. And look at the curvature of that spine. It's really, really awful. And that can, when you stand up, for some people, that's how it remains, and that's not good. The middle picture is actually one showing a spiky ball releasing the hip flexors. That doesn't have to be done on the floor. That can be done on a wall. So there's lots of ways that you can do it without actually feeling like you're getting down in your workplace and rolling around on the floor. Body regions affected by standing work. Again, the big one we often feel is the low back. So, and that is particularly a lot to do with the fact that we don't always stand correctly. So if you look at the bottom left-hand corner, you can see a lady in that stooped position at the top, and then her hips are forward, hip flexors. The glutes are not holding her in the right position. Moving to the right picture, she's tilted the pelvis a little, those shoulders are back, and that's taking the pressure off the low back. That far left picture, it's got all the stress into the low back. So long back extensors get very sore. Your abdominals and hip flexors are, again, you're just in the position that they're not really designed to be. Again, neck and shoulders and so on. So now we're just going to have a little look at whoops, hang on, I'll just go back. We're just going to have a little look at a video that we've put together to explain it a little bit. So I will now be showing you how we can use the spiky ball and the foam roller to help achieve release into your muscles, iron out some of those points of tension that you may have developed through sitting for long periods or even standing for prolonged periods where the muscles have started to feel like they're seizing up. The spiky ball and the foam roller can help get the blood flowing to these muscles, get the nutrients flowing to these muscles, and just allow for that extra benefit of being able to stretch more easily and to then strengthen as well. So what you'll do with these pieces of equipment is actually hold into a spot. So if you find a spot, and your body will tell you where you need it most, you can direct it basically to an area, but your body will say to you, oh, there's a really tight, tense spot. And what you can do then, add extra pressure. So really push into it and hold into that. And you'll start to feel how it dissipates a little bit. It'll start to give, and the pain won't be quite as extreme as it initially felt. The first place we'll start is with the spiky ball on the back. So you can basically place the spiky ball up against the wall and lean into it. What we're looking for are areas of tightness. So if you do find a spot, you'll actually hold into it and give it a little bit of extra pressure before you then move on. The next place we will move is into our neck. You'll probably have experienced tightness in the neck when you've been sitting down and looking at a computer or down into a book or whatever it might be. So we just place the ball between your neck and the wall and just work into the sore spot. The next place we will move to are the shoulders. So taking it to the outer edge of your arm, just below your shoulder, and just working into areas again, looking for points of tension. These points we will try and apply a little bit more pressure. You can add movement through the pressure as well, so that will just get the muscle moving over the top of the ball. From here, we may take it down into what we call the lats, which is underneath our arm and towards our back, between our shoulder and our shoulder blade, or between our armpit and our shoulder blade. And again, we can add some more movement through that, just to get muscle movement under the ball. The chest is an area that a lot of tension can build up in, and so you may find there that you have to spend a bit of time. And adding stretches as you're rolling, again, getting that movement. Remember to apply the pressure as you need it to the areas that your body tells you you need it, and hold it until it just starts to dissipate a bit. We shall now move down into our lower body. So the hips and glute area are areas that can get very tight through sitting. So we will place the ball on the side of the hip, between your hip and the wall, and again, applying pressure, pushing into the ball, looking for points of tension. You can then move through into your buttocks, and you'll soon find spots that you really need a bit of attention. Add a bit of movement again, raising and lowering the leg and looking for those tight spots. The foot is another area that can really benefit from the spiky ball. Placing the spiky ball underneath your foot and just rolling through, looking for the points of tension that will start to get the blood circulating to these areas, which is what it's about. Our next piece of equipment that we will use is the foam roller. This is covering a little bit more surface area at one time, so where you may have used the spiky ball to get into more specific areas, the roller can cover a slightly larger area. We place the roller underneath your shoulder blades on your back, supporting your head with your hands, placing your fingers together, running your thumbs down the outside of your neck, and just lifting into the hips, raising the hips, and rolling through from your shoulder blades up to the shoulders. Now we can again take it to the lats, which is underneath our armpit towards our shoulder blade, and finding any points of tension through there. These areas can be very tight from sitting down at a desk. The lower back is another area that we find tension. We're looking for the area between your ribcage and your hip, either side of the spine. We're never rolling directly on the spine in that lower back region, just either side of the spine. The next spot that we might go to are the hamstrings. So these can be very tight from a lot of sitting. So we place the roller underneath the top of the thigh at the back, and again, looking for those points of tension. You can add a point and flex with the foot. The calves are another area that we will often find a lot of tightness. Placing the roller underneath your knee and making your way down to the back of the heel. We'll then add some movement again, point and flex the foot. You can turn your foot in, turn your foot out. We'll finish off with our quads, which are at the front of the thigh, just below the hips. Start by placing the roller at the top of the thigh and rolling through towards your knees. This can be a very, very tender area, so go softly, but don't avoid the sore spots. Add some movement through it. You can add a little stretch by just raising one leg. You can even hold onto your foot if you want to and roll through that. You'll start to feel the warmth in the muscles, the blood will be circulating to the muscles, get rid of all the knots and the tensions and allow the nutrients to flow into those muscles and help them heal. You should never apply more pressure than, say, 7 out of 10. You'll be uncomfortable and it will be sore and it will hurt, but not to an acute pain stage. So just always bear that in mind. But we're looking for extra blood flow, extra warmth and nutrient flow to these muscles. So we do need to apply quite a bit of pressure and then roll through it again. So that's the principle of that. You can then add extra by using pieces of equipment like these resistance bands, which you can use for strength exercises, which is highly beneficial after you've released and then stretched a little and then utilise the band or whatever it may be to add strength exercise. Okay, so yeah, hopefully that helps explain it a little bit more. Now, HealthSeek is the business that I operate. It's located in Yorktown Square in the centre of Launceston, and we actually run release sessions during the lunch break throughout the week. These sessions are designed to rectify some of the issues of desk work as well as standing work. Whilst you're part of a group, you'll be able to work on your individual problems. The sessions run for between 30 to 45 minutes, and you're welcome to just attend part of the session if time is a premium. There is no need to change. Workwear is fine as long as you can move a little. And we also visit local workplaces for privately run sessions. So hopefully that's given you a little bit more information. And I think we'd probably be about ready for questions, Stephanie.
Yes, certainly. Thank you, Di. There is still time, everyone who still is hooked in, if you would like to submit questions. A couple of questions that have come through is in relation to where can you buy the spiky ball or the roller from?
Okay, well, I actually do sell them, but if you're not in Launceston, you can purchase them from most sports stores, physios. Yeah, they're probably your best bet.
Okay. That's basically the main question that that has come through. Yeah, I think people certainly the video certainly explained a lot about self myofascial release and stretching, and obviously there's been a lot of interest from those who have hooked in to obviously I guess look at actually incorporating that possibly into their into their workplace.
Yeah, yeah. There's lots of opportunities, and as I say, it doesn't need to take a lot of time. So you can, you know, people can do it individually, or if they find that they're not motivated to do it as individuals, then you know, private little sessions can be run either by yourself or by someone trained to do it.
Mm-hmm.
Yeah, so it's a really good way of just breaking away from the activity that you're on, but you can still maintain. I sometimes think if I'm doing, you know, extended a lot of book work or so on, and I'm trying to concentrate on a problem, and if I'm getting a bit stuck, I'll get up and I'll use the spiky ball against the wall, and I use that for thinking time, and it is actually a really great way to sort of break your task and get your concentration levels back.
Are there similar classes that operate in Hobart? I know you're in Launceston.
Look, Stephanie, I'm not entirely sure. I have heard people say that they haven't been able to find them elsewhere, but the simple thing is to do to do is talk to either physios or exercise physiologists or even your gym and see if they're willing to introduce something, because it's very beneficial, and I'm sure they'd be happy to accommodate.
One question that has come through is that should, I guess, these release exercises be avoided during muscular strain?
Yes, so you mustn't, yeah, that's a really good question. If you've got an injury, for example, if you've got a corked thigh from a football game on the weekend, you must never actually apply pressure to the area of inflammation. So avoid that, but that's not to say that you cannot roll around the region, because the muscles and the fascia around the inflammation will be holding on for dear life because they're protecting the area. So we want to give them a chance to go. It's okay, you can let go, but not really apply all that pressure into the area of inflammation until it feels happier to do so.
Okay. So another question that's come through, would you recommend a few target sessions per day, or rather the whole body a session?
I would say do it in small doses if you like, because I mean, it really doesn't matter. Probably, yeah, the small doses is probably going to be more beneficial in some ways. If you think about if someone's, you know, working from 8:30 till 5:30 and they're predominantly at their desk or standing, whichever it may be, you're there to break away for even just 5 minutes once an hour or once every, you know, hour and a half or whatever it might be to work on one region, then go back to their work and then repeat in another region a little later on, then that's going to be really beneficial. To go through the whole body does take quite a bit of time, and the thing is, until you get to some of the regions, you don't realise how sore they are. So you might find that you might be there for a little while. So yeah, I suppose it really is dependent upon what your workplace can accommodate. But I like to think perhaps even up and down a bit, because that's getting that mobility in there as well, which is really important.
And I guess your video presentation focused, I guess, on obviously the feet and the shoulders. Are there any exercises for the hands?
Yeah, true, good. Yes, you can actually use that spiky ball. For example, if you're working on a computer keyboard a lot, you might find that the area between your wrist and your elbow and the top of your arm might get quite tight. So you can use the spiky ball just to roll, like push into that, and then you can add a stretch by just turning your hand in underneath. It's a bit hard here to show, but yes, turning your hand in underneath and pushing down and getting that stretch through the wrist. So yeah, there are lots that you can do through there as well.
Okay. So we've still got a couple of minutes if anyone wants to submit some other questions. A few questions have
Sorry. Yep.
a few questions have come through just in regards to your video. Is that available on YouTube?
It's not currently. I was actually going to put it on my website, but I haven't done that yet, and I'm not technologically savvy, so it might take me a while, but yes, I intend to put it on my website.
You used a spiky ball as well. A question has come through, can a smooth ball be used?
It can. You can use a tennis ball, you can use a lacrosse ball or a hockey ball, anything hard like that. I like the spiky ball because it just gets in a little bit more. but, you know, a matter of preference.
Okay.
I think probably one
Mm.
thing to really highlight too, Stephanie, is the fact that it's really important, once you've done these, it's really important to strengthen those areas so that they just don't bounce back, because that is the risk, is that if you actually don't try and then rectify the reason why they've got there in the first place, then they may just bounce back. So you've got to try and look for the opportunities to strengthen as well.
Are there any workplaces who, for example, do you know of any workplaces who currently sort of perform these exercises?
Yeah, I met with a few workplaces in Launceston, and I have workers come into the studio. They're still discovering the benefits of it, so it is still quite slow and new to that. But yeah, I was actually in a workplace yesterday where we did a bit of work into that. We looked at some of their ergonomics and then how they can overcome some of the issues that they're feeling from prolonged lack of movement.
Okay. Just a couple final questions that have come through. Where was it now? Should foam rolling be done before or after weightlifting?
Okay, so foam rolling or spiky ball, whichever it might be, self-myofascial release is beneficial to, as I was talking about, getting the blood flowing to the regions and warming up. It's an excellent warm-up tool. So I would recommend to do it before. If then in the, following couple of days you're getting muscle soreness, which is, that delayed onset muscle soreness, then the foam roller can be really good to work out some of that soreness. But it's a really effective warm-up tool. In fact, they're finding it more effective than the old dynamic stretching. So combined, foam rolling or myofascial release and a bit of dynamic stretching, but really getting, you're not tiring the muscles, you're just getting the warmth and the blood flow and everything circulating to the area that you need it.
Just another question. Has any benefit been demonstrated using the rollers following either heat, ice of the muscular region?
So you're talking about injury there, I presume, and that really goes back to the question I answered earlier, in that we do not work into an area of inflammation and injury. So ice is your first port of call in the event of injury or rest, rest, ice, compression, elevation. Maybe in the following days, depending on the level of the injury, depending on the grade, then you could do some foam rolling, but that really is very dependent upon the level of the injury. And again, not working directly into the area of inflammation.
Okay. And if anyone wants any further you've had your I guess information up there about where you are. So if anyone wants any further information about what you run in particular, more than welcome for them to contact you.
Yes, definitely. The website is 3W's healthseekconsulting.com, and you'll find all our contact details there.
All right. Thank you very much, Di.
Thank you, Stephanie,
For the
for the opportunity.
presentation, and thank you everyone for joining us this morning. So on behalf of WorkSafe, thank you Di from HealthSeek for presenting self-myofascial release and stretching in the workplace. As mentioned at the start, we are recording today's webinar. It will be made available on the WorkSafe site after WorkSafe month finishes on the 30th of October, but please do stay on your computers to complete the short survey. Provide us with your comments and feedback about today's presentation and your webinar experience. So thank you Di, and thank you everyone, and have a great rest of the day.